Hi, and welcome to Staying Healthy. Today we're here with Dr. Dennis DeSilvey, a cardiologist at Waldo County General Hospital, and he's going to be talking to us today about herbal medicines and alternative medicines and how they affect heart disease and the treatment of heart disease. I think that this is a topic that is of great interest to a lot of people, and there's so much confusion and questions around this. So welcome, Dr. DeSilvey.
Pleasure to be here, Andrea.
Thank you. So can you just talk to us, maybe your definition to start of alternative therapies?
Well, let me begin by thanking you for inviting me to talk about something that probably many of our listening audience are out there and viewing audience are out there sort of saying, what is a conventional physician doing talking about herbal medicines? And the way I would approach that question is to say what I always said when I was teaching at the University of Virginia and gave a lecture on what I call complementary, important word, complementary and alternative therapies for heart disease, or any disease, but we're going to talk about heart disease specifically today. And the lecture was called Complementary and Alternative Medicines. If you don't ask, they won't tell. And that is basically that a lot of our patients are taking these medicines, and because they think that their doctor won't understand what they're doing, then they don't tell.
All right.
And so I have seen just about everything. Tony, your colleague, recently took a picture of, I think there was something like 50 different bottles on that desk when we finally did it, that a 94-year-old woman was taking.
Wow.
Who came into the hospital. She's my record. And I like it when patients talk to me about their medications because I consider myself to be relatively knowledgeable. And so I can look at their medications and help them to understand what they should be on, what they don't need to be taking. I have some, as usually is my case, some fairly strong feelings about what's good and what's not good. And I try and help them take them. I take herbal medicines. I have been part of the Physician's Health Study for 30 years. I started out 30 years ago taking 4 pills. One was a theoretical vitamin E, one was a theoretical beta-carotene, and one was a theoretical vitamin C, and one, which I'm still on, was a vitamin.
All right.
And over the years, the physicians that are leading the study at Massachusetts General Hospital have taken away the beta-carotene because it was shown to be harmful. The vitamin E because it did nothing. The vitamin C because it had no benefit. So we're still taking the vitamin, and they inform me that I'm going to be on my little push out the pill vitamin for probably another 3 to 5 years before they have the final results. But that just tells you that we're very aware of the desire of people to do everything they can do for their health. And a lot of these herbal medicines are very good.
Wonderful. I think that that's really important for people to understand that a traditional medical doctor feels that way, because then they are going to be much more comfortable talking to you. And there is evidence, right, that these herbal medicines can interact with your prescription medications, right?
Very definitely, very definitely. A good example is that a lot of them interact with a drug called Coumadin. That many people take. A lot of them are blood thinners. Ginkgo biloba is to a degree. Hawthornberry is to a degree. The other important point to keep in mind, and I make this point to my patients a lot, is about a third of what I use in allopathic medicine, which I practice, they're herbal medicines. Digitalis, for example, which we use for heart, came from the foxglove. It's derived from the foxglove plant. Where does aspirin come from? We all use it. The bark of the willow tree. The cholesterol-lowering medications that we use, the statins, they come from something called red rice yeast. And it's a yeast that forms on red rice that actually makes the statin. And so the 3 original statins that we use, pravastatin, simvastatin, and lovastatin, are all direct derivatives of red rice yeast. And in fact, there have now been studies that show that if people can't take the statins, they can try red rice yeast, and it sometimes works very well to lower their cholesterol. So there are a lot of very good herbal medicines. I didn't finish my own saga, but I take 1 aspirin a day. And I also take fish oil, which is very good. Fish oil is a good example of the complexities of the problem, because it really, unfortunately, appears that you need the fish oil.
Right.
That you need. I take the Norwegian cod liver oil, which comes in a green bottle. It feels just as bad going down as it did when I was a kid, even though it has lemon flavor. There's suggestive evidence that the oil and fish contain something called selenium and vitamin D, and those seem to be important to add to the fish oil. There are a lot of very effective over-the-counter herbal medications. The other caution I would say to people who want to do this is, again, I wouldn't be talking about this unless I want you to discuss it with your doctor.
Right.
But don't go out and buy yourself the bottle that contains Forever Young or Total Joint Health, or I could go on and name them, because you go through the ingredients in these things, and I don't know where they get them, but it's pig brain and desiccated lamb liver and stuff like that, which has no proven scientific benefit. The other caution I would ask people to understand about the herbal medicines is they're not FDA controlled.
Right.
So that you don't know that you're really getting what's in there.
Oh, right.
In fact, to that point, one of the pharmaceutical companies recently came out with a tablet fish oil that's approved by the FDA, which we know is really fish oil.
Right.
I still think it's better to take the fish oil.
Now, I know from people that I've spoken to that sometimes their chiropractor or their naturopathic doctor will say to them, take this specific brand because it is known to be pure. How do people know? Is there a way to find out if what you're taking really is the best form of whatever that is?
Andrea, great question, and unfortunately the answer is no.
All right.
That unless you want to take your tablet to some type of research facility that can analyze it, but they have gone into supermarkets and drugstores, taken the same pill from 3 different manufacturers off the shelf, and ended up finding that some didn't contain any of the indicated compound, others contained a little bit but not a lot.
All right.
So it's a very complicated science, and that's where the doctor really needs to help you out.
Wonderful. Well, we are almost out of time, but I think that this is a topic that is on a lot of people's minds, and I really appreciate it, and hopefully we can visit it again and maybe talk about something a little bit more in depth. Thank you very much.
Thank you very much, Andrea.